everyone, my name is Christine, and today I'm going to be talking to you about RSV, also known as respiratory syncytial virus. Now you may be asking yourself, why am I talking to you about this topic? Two reasons. Number one, it's for an assignment. Number two, I'm a mom. I have two kiddos, a 2-year-old and a 3-year-old, and I remember when we first had my son, we really were kind of clueless. People kind of tell you things, what to do, what to not do, what to expect, but until you're in that situation and actually living in that moment, only you can make those decisions. So hopefully some information I give to you today will be helpful to you in this upcoming RSV season. Now, the first thing is RSV is a lower respiratory tract infection, meaning it affects the airways of lungs of little ones. Normally, every kid, by the time they're 2, they've had RSV of some sort. Normally, it's a regular kind of cold symptoms, runny nose, cough, sneezing. Sometimes they'll run a fever, sometimes they won't. It just depends on how the immune system is fighting it off. So RSV, it's important to know also, is a virus. So in a virus, we normally treat symptoms. As long as it's not as severe, and we'll talk about that in a second. So there's really no cure for RSV. There's no medication that we can take just to completely clear it up, kind of like the common cold. And there's no vaccination as of yet, but doctors are working on that. So we already know that RSV affects the lower lungs. So sometimes your little one can develop a cough. Sometimes it'll turn into some wheezing, and sometimes not. It just depends. Now there are a certain group of children that definitely need to be very, very cautious during RSV season. And these are the kids, I'm going to read you from my list. These are the premature infants, your infants younger than 6 months old. 2-year-olds with chronic lung or chronic heart diseases, kiddos with weakened immune systems, and then also kiddos with neuromuscular disorders. So these are your high risk kids that if they do develop RSV, they potentially could be hospitalized. RSV is the number one reason that infants get hospitalized. If someone gets RSV, and it's a severe case of RSV, they get hospitalized. Well, it's a severe case of RSV. Usually, the common cold symptoms, the sneezing, the coughing, and all that, it'll actually turn into bronchitis or bronchiolitis, which is an inflammation of those, like we talked about, those respiratory airways, those lower respiratory airways, or it can cause pneumonia, which would be a lung infection. And both of those are no bueno. Because it's going to affect our airway, it affects our breathing. And if you can't breathe, you can't live. So there definitely are interventions that have to go into that. Like I said, there's no cure for RSV, but we'll be treating at that point, the hospital would be treating that bronchiolitis and that pneumonia for you. Let me see here. We already talked about that. Approximately, I did find out some information for you, approximately 57,000 kiddos aged 5 and younger do get hospitalized in the US every year because of RSV. And if I didn't already say it, remember your RSV season is from fall, winter, and spring. So it's a long ways. You're probably saying, Christine, how can I prevent RSV and what the heck is it? Like, how do we get it? So basically, the RSV virus is contracted by sneezing, by droplets. So someone that sneezes, someone that coughs, those, you've seen those videos, somebody sneezes and it's going like a million miles an hour. You have all these little droplets that are going towards you. So just like that, you can, they can get in your eyes, in your nose, in your mouth, and all that can be absorbed in your bloodstream eventually. And then guess what? You have RSV or your kids have RSV. But RSV can also be from direct contact. So now let's say that someone sneezes, right? And they sneeze like this instead of like this, like we're taught. And so they sneeze in their hand, they touch the door, they turn it. Then all of a sudden you go over, or your baby for that matter, touch the door because my 3-year-old has to open up all the doors. Don't touch them, don't open them up for him. It's his job. So he touched the door and they open it up. Now they have it on their hands. And what do kids do? They touch their face. My 2-year-old, she sucks her thumb, like all this stuff, right? So now that virus is getting in all of those crevices. Potentially, now they have RSV. So RSV can be prevented, right? So don't touch your face. Wash your hands. Remember, we're in COVID season, so everyone knows, wash your hands for 20 seconds or more. And then make sure that you're washing them with soap and hot water or warm water. And then remember, it's the soap, the antimicrobial, the hot water, and the mechanism of rubbing your hands together that gets those microbes off, that all those little viruses that are trying to get us at RSV gets washed off, and then we don't have to worry about it. A couple other reasons, or a couple other things that you can do is avoid being around sick people. If someone is sick, you have plans, you want to go over to their house, and they're like, oh, I have this cough. Not going. Don't bring my baby near that. Another thing to keep in mind is since the virus can stay on inanimate objects for a period of time, toys that they play with, lots of times if the kiddos go to school or they go to daycare, those toys potentially, daycare schools are like big germ fests, so who knows really what's all on those. They do the best they can and clean them, but make sure that you're also cleaning your toys. When your kids get home, right, from daycare or school, have them wash their hands. Before they do anything, they come in the house, just have them wash their hands. That's good practice. Something that I did want to mention is that once you do come in contact with the RSV virus or your kiddos, you will potentially develop symptoms if the virus is going to take effect in the body between 4 and 6 days. And that's after exposure. That's after those little droplets have gotten in. And then also something to mention is someone that has more of a weakened immune system, lots of times they'll get, if they get the virus and then they start feeling better, they're actually carriers for a very long time. 4 weeks after they're feeling better, they can carry that virus. So handshakes, kisses even, right? Things like that. Just if they have been diagnosed with RSV or you think, oh, I don't know if it was the common cold or whatever the case is, just no kissing, no touching, nothing. And that'll keep you safe. So you're probably asking yourself too, well, when would I go to the doctor? Like, when would I want to take myself or my kiddo into the doctor? You can take your kid to the doctor anytime that you feel like it. Don't let someone make you feel like your kid has to be dying in order to go to the doctor. If you're worried and you think that there might be something going on with them, take them to the doctor. Keep in mind, however, that RSV is a virus. Viruses have no cure. There's not a cure for them yet. So we just treat symptoms. If your child is coughing or they're sneezing and that's really all that's going on and you take them to the doctor's probably not going to be able to do a whole lot for them except give you education, kind of like I've been giving on tips and tricks. Wash your hands, stay out of daycare, which is another thing. If you're sick, don't go to school, don't go to work, don't give that to anybody else. But anytime that you feel like you need that doctor to look you over, your kiddo over, listen to their lungs, give you that reassurance, then by all means, that peace of mind is golden. But just know that viruses do not have any magical cure. You just have to wait it out. And normally the typical virus takes about 21 days to completely get out of people's systems. So rest, hydrate, good disinfectant, good hygiene, and you will keep you and your kiddos safe during this RSV season. Hopefully you've enjoyed this video. I've enjoyed giving you this information, and I hope you all have a great, great night.